Sanders. We'll now begin consideration of today's bill. For the awareness of all senators and staff, we intend to vote on amendments as they are raised, but will hold the vote on final passage of both bills until the end of the session. We will keep members and staff updated on the timing of the vote on final passage. I'll ask colleagues to limit remarks to 2 minutes when discussing either of the bills or offering an amendment, as there are a lot of amendments to process. As a reminder, when discussing an amendment, please identify which amendment you are discussing by its name and number. We were going to do the price tags bill first, but Senator Marshall has had to leave, and so we're going to hold that until he returns. We'll begin now with consideration of S. 1414, the Expedited Access to Biosimilars Act. I thank Senator Paul for his work on this legislation to improve access to affordable biosimilar medications. I thank Senator Moody, who championed legislation incorporated into this bill via the manager's amendment. At our April hearing on the biosimilar and generic drug market, we heard how biosimilars lack regulatory certainty and have exorbitant development cost. In the 15 years since the biosimilar regulatory framework was created, we've learned a lot about how to ensure they are safe and work for patients, but laws have not kept up. This bill addresses these problems by reducing data required under law that in many cases is unnecessary, and it aligns with the FDA's common practice to provide clearer rules for biosimilar developers. It establishes a clear, consistent process for when FDA needs to require additional studies. It also eliminates a redundant requirement that multiple FDA offices review each biosimilar before approved. I'm glad to see this legislation progress through committee. I encourage colleagues to support. We have a manager's amendment to S. 1414. I move to adopt the manager's amendment in the nature of a substitute and to have it considered original text for the purpose of further amendments. All in favor say aye. Aye. Opposed, no. The ayes have it. The motion is agreed to. Do any members wish to speak on the bill? Senator Paul.
Prescription drug spending is mainly concentrated on biologic drugs like hormone therapy, cancer treatments, and monoclonal antibodies. Biologics are only 5% of prescriptions but account for 51% of spending. My bill seeks to reduce the cost of biologic drugs by removing the blanket requirement for comparative efficacy trials in biosimilar development, which are often unnecessary. These trials are like stage 3 trials that attempt to gauge whether biosimilar and the reference biologic are equally effective. But a review of over 600 studies published in the journal Pharmaceuticals found that no biosimilar with proven analytical similarity has ever failed a comparative efficacy study. The average cost of biosimilar development is $100 to $300 million, and comparative efficacy studies generally cost $20 to $30 million. Removing these unnecessary studies, as they have already done in Europe and in England, would reduce development costs by 10%. Additionally, the studies can also take up to 3 years to complete, and biosimilar development can take up to 9 years. Delaying treatments for the sake of conducting unnecessary studies harms the very people we intend to help. The FDA has realized that these burdensome nature of these studies, and in its recent guidance, the agency waived comparative efficacy studies for therapeutic proteins like monoclonal antibodies. We've worked with the FDA on this bill because when a biosimilar is proven to be safe and effective, there's no reason to delay care to patients and regulatory certainty to manufacturers. I urge my colleagues to support my bill to significantly lower the cost and the time of biosimilar development.
Does anyone else wish to speak? The officer raises his hand, but I'm thinking that no, he's just checking his earpiece. We'll now begin consideration of S. 4189, the Insulin Act of 2026. I thank Senators Collins as well as her co-leads, Senators Shaheen, Kennedy, and Warnock, for their leadership on this piece of legislation. I appreciate their efforts to help make life-saving insulin more affordable. I recognize that this legislation may need more refinement and may encounter policy and procedural hurdles beyond this committee. I am pleased that we were able to advance it to the next stage of the legislative process. We have a manager's amendment to S. 4189. I move to adopt the manager's amendment in the nature of a substitute and have it considered original text for the purpose of further amendments. All in favor, please say aye. Aye. All opposed, say nay. The ayes have it. The motion is agreed to. Do any members wish to speak on the bill? Senator Collins.
Thank you, Mr. Chairman. First, I want to thank Senator Shaheen for our longstanding partnership on this bill As co-chairs of the Senate Diabetes Caucus, which I founded in 1997 to increase research funding and promote better health care for people with diabetes. I also want to thank Senators Kennedy and Warnock for their contributions. Beginning in 2015, I chaired 8 hearings on prescription drug prices when I chaired the Senate Aging Committee. We heard countless stories from Americans who are struggling to afford the medicine they needed, and the unaffordable cost of insulin was featured prominently at almost every single hearing. The bill we're marking up today is the culmination of these efforts. While recent decisions by manufacturers to cut their list prices on insulin is encouraging, there is still more work to be done. Our bill would cap the cost of insulin at $35 a month for individuals who are on commercial insurance plans. According to the American Diabetes Association, nearly 40% of people with diabetes have rationed or skipped insulin doses due to the cost. One of my constituents, Beck Hoskins from Chelsea, Maine, skipped doses of insulin when she was unable to afford it and ended up in the emergency room. The Insulin Act would help people like Beck afford the insulin that they need to survive. The bill not only caps out-of-pocket costs for patients, but addresses perverse incentives in the market and the lack of biosimilar competition that contributes to high list price for insulin. Although the bill has some other issues in it that I'd like to go through, including citizen petitions, which are largely backed by brand name manufacturers who were behind 86% of them, which is why FDI denied more than 9 out of 10 of them. I am mindful of the chairman's request that we keep our remarks brief. So I would like to end by thanking our committee co-sponsors on this bill, Senators Murkowski, Tuberville, Banks, Baldwin, Kane, Blunt, Rochester, Hickenlooper, and also Brooks. I want to also thank all the patient groups that have endorsed our bill. Thank you.
Senator Paul.
I respect the intentions and motives of those who would like to see lower insulin prices in the bill, but historically, price controls don't work. If you want